Hi there, my name is Brooke Sanders and I am applying for the MSc Applied Criminology and Forensic Psychology program at Edinburgh Napier University for the fall of 2018. This program really stuck out to me after I had a childhood friend enroll last fall and say it was the best decision she had ever made. I've known my career choice since I was young, and forensic psychology has always been my passion. This program would allow me to further my collegiate career and eventually lead me to greater opportunities in the criminal justice system. The particular reason why I wish to study in Scotland is due to the difference in methods for imprisonment. The United States tends to focus mainly on incarceration, while Scotland focuses on rehabilitation, which has been proven to be far more effective than the latter. Rehabilitation leads to lower recidivism rates while not wasting the taxpayer money. I want to learn more about these methods in order to use them in other systems around the world. This program fits in perfectly with my future plans because my career goal is to become a forensic photographer. Because crime scenes are often cleaned up as quickly as possible, it is important that there be a professional, competent photographer on site to freeze that moment in time before it's gone. I created my own freelance photography business from the ground up and have been quite successful over the past 5 years. While following my passion of capturing moments in time, I did not forget about my first passion of forensics. I did some research and found the perfect career for myself and am dedicated to achieving that position. It would be the greatest feeling to have my photos used to help solve a crime or have them used as evidence in a courtroom, as usually photos are the first tangible evidence a jury will see. Taking my own photos will allow me to enter the mind of a suspect and also to examine the image even more thoroughly to be able to possibly find new evidence such as unnoticed blood splatter, a silhouette in a nearby window, or even discrepancies in the position of the weapon that was used. As a forensic photographer, I would be given the opportunity to record the initial appearance of a given crime scene as well as the physical evidence to provide a permanent record for the courts. There are multiple aspects of forensic psychology that particularly interest me, but the thought of how specific factors may increase the likelihood of an individual committing a crime is what interests me the most. There have been countless studies on the link between mental health and crime which show the correlation between the two subjects. In a review of 13 studies published between 1965 and 1981, it was found that mental health patients were 3 times as likely to be arrested as the general population. On the subject of mental health, there are biological factors that contribute to this likelihood, such as having a family history of antisocial personality disorder has been shown to increase the risk of development of conduct disorder, aggression, and antisocial behavior in children, as well as having a family history of homicidal ideation or attempts has been directly associated with extreme aggressive acts. There are also many individual psychosocial stressors that have an impact on the likelihood of an individual committing a crime, with an example using the social learning theory, which states that violent behaviors are a product of past experiences, such as violent images in the media desensitizing viewers to violence, and how history of family violence is predictive of violent behavior. These links have always fascinated me, and I believe that there is more information that we can continue to learn in order to prevent future crimes from occurring. When applying to my undergraduate program, I ultimately decided on a criminology program in order to further my knowledge of the forensic aspect of psychology. I used my time as an undergraduate to study crime and criminals to understand why some people are more or less likely to commit crime, to explain the differences in crime rates amongst various populations, and to study not just the social level, but the individual level of crime. This degree opened my eyes to an incredible subject that has quite a bit of room for growth and research. Although I have not been directly involved in an actual study, I have been able to test my research abilities in a research methods course during my undergraduate career. My selected subject was which factors increase the likelihood of female killers and which factors have a greater impact than others. Even though I was unable to conduct the study due to my qualitative method requiring allowance to visit and interview female inmates, I would have loved to have been able to follow through with this study to see if there were any prevalent factors that did contribute to these crimes. Immediately after graduation, I placed my collegiate career on hold to gain more professional experience in the field of mental health. I began working at Georgetown Behavioral Health Institute, which is an acute care facility outside of Austin, Texas. My first role was a mental health technician, which allowed me to work one-on-one with patients at a more personal level to be able to truly help them. That experience is one that I will never forget. I was given the opportunity to watch patients come in at their lowest point in life, see them progress through their treatment, and eventually leave and function through everyday life. My hospital participated in a jail diversion program, which allows individuals to receive treatment at a psychiatric facility that will count as time served. After speaking with these patients directly, I was able to see how much better they were doing after receiving the proper treatment and not just being locked up behind bars. About 7 months ago, I was promoted to an intake counselor, which would allow me to work the front lines of the hospital and to help take the initial call as well as perform the psychological assessment, which would give our doctors and therapists a better understanding of exactly what the patient was dealing with. Since I began working at my facility, I learned so much about various illnesses, their characteristics, and how to treat them. This has allowed me to understand criminals and psychiatric patients on a completely different level. Throughout my undergraduate career, I worked a full-time job while being heavily involved on campus in over 5 honors organizations and maintaining an incredible grade point average. Since I was young, I have made it a priority to ensure that schoolwork always comes before any extracurricular activities. I'm an extremely dedicated, organized, and driven student and will give my best on any assignment, quiz, test, or project. I am not afraid to ask for help if I am unsure of something or do not understand a particular subject. I believe that you should give either 100% on something or not do it at all. To me, school has always been about time management and dedication. If you put in the work and the time, it will pay off.